This podcast is going to talk about proportions, more specifically for rhinoplasty, but also for all different types of the face, different parts of the face. So the thing about proportion, I like to use this analogy. I think it's going to make it more sense for you. I think about if you have a glass of water on a television screen, and I ask you, how big is this glass of water? You're going to say, well, I have no reference points to this glass of water. I have no idea how big it is. But once I put a shot glass next to it, the original glass of water now looks large without even changing the size of it. If I put a pitcher of water next to it, the original glass of water looks smaller, and I haven't changed the size of the original glass of water. So everything is about relative proportion. So when you're looking at a face, nose, or whatever it may be, what leads toward more attractiveness is not necessarily symmetry, which everyone focuses on symmetry, but it's on proportion. And so if I make one area larger, another area looks smaller. So for the nose, I break down the relative sizes of the nose into the bridge, the tip, and the sides of the nose, or the ala. So if you think about this, let's take the bridge. You have a very low bridge, like in an Asian, for example, and you don't like how fat the tip looks. If I raise the bridge, the tip can actually look smaller. If I over-raise the bridge, then the tip can look too diminutive and too small and short. The sides of the nose, everyone thinks, when you're dealing with ethnic nose, that the flare of the nostrils is important, and the vast majority actually do something with the nostrils. But when the nostrils are very flared looking, as what you think it is, but then actually the central tip is the problem, and you can't make the tip too small in an ethnic nose. When you try to reduce the sides of the nose, you may make the center look disproportionately too large, and then make the whole thing look off. Another interesting thought is the aging of a nose, or aging in rhinoplasty. People say, my nose certainly got a lot bigger at the age of 40. But if you look at Leonardo da Vinci, when he shows aging noses, they don't really occur until the 60s or beyond. So the question then is, if aging of the nose occurs down the line, then what is happening at the age of 40? Is there some kind of aging going on? And actually what's happening is that we oftentimes lose volume to the rest of the face. And the nose, which is mainly hard architecture rather than soft architecture, is maintained more because we lose more soft architecture like fat and soft tissue of our face, and we do hard architecture. So the nose becomes proportionally larger in appearance to the face. Even though the nose actually didn't get larger, the face got smaller. So this is all the ideas of proportion that I just wanted to give you some ideas. And so this is why our artistry for anything on the face or any part of anything cosmetic is such an important thing, because you can follow rules and say, this must be a certain size, that must, but really what it comes down to is proportion.